where do you perform your surgeries?
Well, I have full privileges at both hospital systems. So if I went to the hospital, I would use Matthews or the old CMC, I guess it's CMC Pineville. I'm so used to calling it Mercy South. But I very seldom go there, and I don't have anything against the hospitals, but I prefer to use my own operating room, which has every bell and whistle you can possibly need. The reason being that I think the anesthesia we provide is more organic or better for the patient. We don't use exotic gases as they do in the operating rooms in hospitals. And the reasons hospitals like those exotic gases like xenon, and they're all got several different names that I can't recall off the top of my head, is that they're fairly cheap and they work. The only problem with exotic gases is they're also fat soluble, and they take a long time to get out of your system and tend to make people feel dysphoric afterwards or funny, and are associated with more nausea and vomiting. So we only use oxygen in our operating room and keep people under anesthesia using a IV, which has a micro drip machine that drips in Diprovan and what's known as fentanyl or remifentanil, which are both readily excreted by the kidneys and liver. They're not fat soluble, so they are out of the patient's systems literally within 30 minutes to an hour after surgery. So they feel better, faster, less nausea, less vomiting, less dysphoria. And also my personnel, myself, my nurse anesthetist, who's certified anesthetist for over 25 years, my nurse, my scrub tech, they've all only worked for me for years. And they're a team that is fine-tuned, if you will, to do what I do. Whereas when I go to the hospital, I may be working with somebody that hasn't done the sort of things I do ever, or if they have, for a long time. It takes a lot longer. Their instruments aren't as good as mine. When the patient gets to recovery, here they're recovered one-on-one by my nurse, who watches them like a hawk with me, and then certified anesthetist readily available. The hospital, that may not be quite the case. And again, of course, the nurse is used to the procedures. So I highly recommend patients use my facility, but am willing to go to the hospital if they so desire.